In this Hypertension Awareness Week, I take this opportunity to share some information regarding hypertension and elevated blood pressure. Now, what do you mean by hypertension? Hypertension is defined when a person's blood pressure is persistently above 140 systolic or more than 90 millimeter diastolic. Most of the cases of hypertension do not have any cause, and we term it as essential hypertension. Almost 90 to 95% of the cases of hypertension are essential hypertension, where no definite background cause can be found. However, certain small subset of the patients have got some secondary causes leading to their hypertension, like certain hormonal diseases or endocrinal diseases, certain chronic drug use, some cardiovascular ailments, and some kidney related disorders that can lead to hypertension. In essential hypertension, the major risk factors are positive family history, obesity or being overweight, high salt intake in the food is one of the principal cause of hypertension among the Indian population, smoking and also heavy alcohol intake is one of the very important causes of hypertension, particularly in the urban population, taking junk foods, not exercising adequately, taking high calorie foods, all can contribute to the development of hypertension. So primarily it is many of the risk factors of essential hypertension are lifestyle related. Many cases of hypertension, it is also closely linked to development of diabetes or cholesterol related disorders. Unfortunately, in most of the patients or majority of the patients, hypertension do not produce any symptoms, and it is usually diagnosed during routine health checkup. However, in a small subset of the patients, it can produce certain symptoms like heaviness of the head, blurring of the vision, chest discomfort or chest heaviness, palpitations or neck pain. In some patients, the first presentation of hypertension can be in the form of stroke or heart failure or heart attack or acute myocardial infarction. The major risk of hypertension is that it is asymptomatic, and in most of the cases it is diagnosed during routine medical examination. So, unless and until you do routine medical examination, it can be overlooked, and this undiagnosed hypertension for a long period of time can lead to some irreversible damage of your cardiovascular system, heart, it can damage your kidney, even it can damage your eyesight. Very high blood pressure can also lead to stroke, heart failure or acute heart attack. So it is very important to check your blood pressure periodically after a certain age and take medicines properly. First is that do not skip your medicines who are hypertensives, because hypertension is a disease which cannot be cured and can only be controlled by medications. So daily medications, proper monitoring of your blood pressure is very important. Many patients we see that they are taking medicines but their blood pressure is not adequately controlled or not under a particular level. So it cannot reduce the risk of hypertensive related complications. So compliance or adherence to the medications is very, very important, and is possibly the most important factor. Adopting certain healthy lifestyle modifications or lifestyle changes that can go a long way in controlling hypertension, like reducing the salt intake in your daily diet, reducing the intake of junk food, fried food, fatty foods, reducing body weight to a healthy level, keeping the body weight in a healthy level, daily physical exercise, light aerobic exercise for 30 to 40 minutes a day is very helpful in controlling blood pressure, and also avoiding certain drugs which can lead to increase in the blood pressure, or avoid the over-the-counter drugs or out-of-prescription drugs that can lead to high blood pressure. Now, in this COVID pandemic, there is also fear among the patients who are taking antihypertensive medications or who are suffering from hypertension or diabetes, that whether hypertension can lead to increased risk of COVID infection or COVID related complications. However, this is not entirely true. It has been seen that most of the patients who are suffering from severe COVID related complications, they also concomitantly suffer from diabetes or hypertensive or heart diseases, but per se hypertension do not increase a person's risk of developing COVID infection. But it is very important that during this lockdown period or COVID situation, not to skip your drugs, check your blood pressure regularly at your home, maintain a blood pressure chart, and if you see that the blood pressure is not adequately controlled with the present dose of medications that you are taking, feel free to consult your doctor regarding change of the drug dosage or modification of the drugs. So these small lifestyle measures, adhering to the medications and avoiding certain bad behaviors can go a long way in achieving hypertension-free India and avoiding the hypertension related complications. Thank you very much.